Good evening, and thank you for joining the Westerly Library in Wilcox Park for tonight's presentation with Living Innovations. This program is being presented using the webinar version of Zoom, and attendees are joining in listening mode only. Please send any and all questions through the Q&A feature at the bottom of your screen. We will do our best to answer all questions within the time we have allotted. Please note that this program is being recorded and will be posted on our YouTube channel. Should you get disconnected, simply use the link that was emailed to you earlier to get back into the program. I will now turn it over to our guest speaker for tonight, Recruiter for Living Innovations, Melissa Bautista.
Hello, everyone. My name is Melissa, and I am the recruiter for Living Innovations. Today, I'm going to be speaking about our Share Living program that we have here at Living Innovations. But before I begin sharing that information with you all, I would like to share a little bit about Living Innovations. So we are a human service agency that support adults with developmental and intellectual disabilities. We have two programs that we offer at our agency. One being Community Connections, which is supporting people in the community. And the program that we're going to be discussing today, it is called Share Living, which is bringing someone into your home. So you guys are going to learn all about what is Share Living and how to become a Share Living provider. So if you guys have any questions at the end, you guys are more than welcome to ask me any questions. So I'm going to begin the slideshow. I'm hoping everyone is able to hear me clearly. Is that correct?
Yes.
Okay. So what is Share Living? Well, here we have a picture of a home provider that we actually have that has been with us for over 10 years. He has been supporting two individuals in his home, both that have developmental and intellectual disabilities. He actually started years ago providing foster care. And that's how he got into this type of program and support. So the gentleman that you see here in the picture, he's with his family, and the gentleman to the right is one of our individuals in our program. So Share Living Arrangement, I'm going to be using a acronym we refer Share Living Arrangement as SLA. So you'll see throughout the presentation that I will be referring to Share Living as SLA. So I just want to make sure everyone understands what SLA means. So it's basically the Share Living Arrangement. So what is Share Living? Share Living is an arrangement where it allows a person that has developmental disability to live with an individual or family in a home-like setting. So it's where people can help with daily activities such as meal, transportation, personal care, and also it allows them to have the individual be part of a family. It allows the individual to be part of things that maybe they wouldn't have been part of before. So it's a great program because it focuses on a lifestyle that engages with a family. Who can live in a share living arrangement? So basically, the individual that can live in this share living arrangement is someone that is eligible for services from BHDDH. Now, I know that many of you probably are like, what is BHDDH? BHDDH stands for the Department of Behavioral Health. So it's anyone that has been eligible for services from the Department of Behavioral Health. So they must be qualified. They also must be in need of 24-hour residential services, and they must be at risk of homelessness, or it could be somebody that is in a crisis. So these are the cases that we get, or individuals that are eligible. Sometimes people can no longer live with their families. So that's another situation. That is another reason why people become eligible for this kind of service and support. So sometimes parents can no longer provide the care to the individual. The person might be ready to move from their parents' home, or they are leaving a hospital setting or a group home setting. So there could also have been a sudden change in their current, support system. And there's also many other reasons, but these are the few reasons why a person might not be able to live with the family, or that is eligible for this kind of support. So who can be a shared living provider? I'm sure you guys are all wondering, okay, how can I be a shared living provider for this program, and how can I support an individual? So a shared living home provider must meet numerous standards for behavior management and fire safety, so which are reviewed during the home inspection and regular on-site visits. So home providers must also participate in trainings that we provide, which are CPR and first aid, and also a pre-service training that we offer to all of our home providers. So the responsibility of the shared living arrangement contractor and the rights of the adults with developmental disability. So how is the home provider qualified? So basically, we do conduct an interview. So that's when a person submits basically an inquiry stating that they're interested in doing this kind of support. Once we receive the inquiry, then we basically move along with setting up an interview with the candidate, asking several questions about the home and the individuals that live in the home, so that we can better know the person, and also so that it can help us better identify a match. We also conduct home studies. So home studies is basically a summary based on the individual. So it talks about, it gives us a summary on the person. So things that maybe you like to do, hobbies, the family dynamic, the layout of the home, whether, the home is handicap accessible or not. All of these questions are being asked through the interview. And those are the questions that we do put on a home study and kind of do a summary on the person. We also run background checks. So we do run national background checks, which is referred as fingerprints. And we also run BCI. So BCI is more on a local level. So we do run those for the actual home provider that's applying. And also for any adults in the home, we do run BCI. So the actual home provider gets the national fingerprint and BCI, and then everyone else in the home, we do conduct BCIs, okay? References, we also run references on our home providers. So that is something that we do with all candidates. Inspections, we do have a list of requirements that are required from the state regulations that we need to follow. So we do give that to our home provider at the initial interview. We do send them that checklist so that they know what to expect, and so that they know what we're looking for when they are ready for the inspection. We also, like I mentioned at the beginning, we provide training. So we do offer CPR and first aid. Some people already come with this certification, so we do take certification from outside, and some people, we do have to provide that training for them. We also ask for homeowners insurance or renters insurance. So some of you may ask, I rent, can I actually do this kind of support? Yes, you're able to do this kind of support as long as the whoever you're renting, you've had this conversation prior with them to discuss, that you will be bringing someone in the home. So that's the only thing that we ask, that our home providers, or the individual that's applying to be a home provider, does ask their landlord if this is something that they're able to do in the home. So there is no issue with us if you do rent. If you own your house, that's great as well. So we do, like I said, we ask for homeowners or renters. We also ask for auto insurance to make sure that you're able to drive the individuals if they're needed if they need to be taken to an appointment. And we ask for other things in the home, like some people have pets. So if people have dogs or cats, we do ask for rabies. We do run a driving record. on all of our candidates that are applying to be a home provider. And we also run Medicaid fraud. So we also run a check to make sure that there has been no Medicaid fraud. Okay. And just I don't think I mentioned at the beginning, a home provider. So share living is the program. It's basically the program is bringing someone in your home. A home provider is a short way of calling the person that's being qualified to take the individual in the home. You'll also hear share living provider. So share living provider and home provider is the same. It's the same thing. We just use those acronyms. So is there an orientation or pre-service? So in addition, home providers receive mandatory training on community integration, the importance of individual service plans, managing access to medical and psychiatric support, self-determination. So like I said, CPR and first aid, confidentiality, that is something that we also review, and how to recognize and neglect and how to recognize the neglect and mistreatment of adults with developmental disabilities. So including like reporting requirements to the Department of Behavioral Health and appropriate law enforcement agencies. And just so you guys know, this is all quoted through the Department of Behavioral Health. So if anyone wants to see further, there is the link below. Why do people do this? So why would you want to be a shared living provider? You know, some people are nurtural. It comes from the heart. They is something that they feel that they want to do and provide. Some of them is a cultural norm. For some, it's an added income. You know, that we do pay a stipend, which is tax-free. So the stipend that you get for this kind of service is tax-free, plus the room and board, which is a separate from the stipend that you would actually get for the individual. Some people desire to give back to the community, so they feel the need that they want to give back. And some have worked in the field for several years. Like we have people that are prior CNAs or that have worked, you know, as a registered nurse, or possibly, you know, they've done direct care. We even have people that don't have any experience that just want to give back to the community, or maybe they do have a personal connection. Maybe they've supported a family member, or maybe they've done, you know, personal care, not in a professional level, but like as a side job. So we do have people, you know, of all different levels of experience that apply to do this kind of service. All of these people, they basically have a good heart. They want to give back to the community. They want to bring someone in their home, and they want to make a difference. So all the individuals that we approve, they all have a reason why they want to do this kind of support. Who are these providers? So we have providers all over the state of Rhode Island. They are in every county. We have people up in Westerly. We have a lot of homes. As you can see here in the map, we have people all over the state. We provide services through the whole state of Rhode Island. We also actually have offices in Maine, New Hampshire, and Connecticut. So we do have other offices that also provide other programs. But we here in Rhode Island focus on obviously our state and finding homes here in the state of Rhode Island. So as you can see, there's people of every county. So people are the individuals that want to find a home. They're looking for homes obviously in the state of Rhode Island and in every county. So everyone is welcome to apply. So that's something that I always tell people. You know, we're always looking for people in all different areas of the state. People who rent and own their home, they're welcome to obviously do this kind of support. So these providers either rent or own their own home. We have people of every background, so every ethnic background. So there's individuals of all different race and different age as well. So we have people that anything from 20 to 30s, 40s, 50s, 60s, all the way. We have individuals of all different ages. And it could be somebody that's single. We have single providers. We have providers that are married or providers with or without children. So there is different dynamics. And like I said, we're not looking for a particular person. We are basically looking for someone that is willing to open that home for an individual, and someone that's willing to provide this care and make a difference. We also partner with you. So this is not something that you are going to be doing by yourself. So it's not like, here you go, we put someone in your home and that's it. Our process entails a matching detailed process. So this is not considered a placement, it's considered a matching process. So whoever's going to be living in your home is going to be someone that is compatible with what you're willing to provide as a care. So that's why we go through the process of the interview. We also are here to provide support to you at all times. So we partner with you. We provide, we assign a coordinator. We also have on-call. So there is always on-call. And so if something happened after hours, there's always somebody there to help you. We provide services to you, and we provide that support, that the support that is needed so that you are able to be effective at doing this kind of support. So you're not alone. If you're wondering, oh, I'm going to be all alone in this. Nope, we provide that support to you at all times. And like I said, it's a matching process. It's a very careful matching process. So we look at location. Location is a factor when we're doing a matching process. Gender, religion, cultural needs, family involvement. So all of these things, day supports, physical and medical needs, all of these things come into the process of matching. So this matching process is not just placing someone in your home. This is a very intense and careful process. Whoever's going to be living in your home has to be compatible with your family or your lifestyle. So we want this to work. And sometimes we do have people that move in with our providers, and maybe it may not work out. It's the same thing. I like to always use the example of, like, when you're dating, you may date a couple individuals and then you find the one. So it's sometimes these things work this way, where sometimes maybe the person that moves in your home is not the right match, and maybe we find someone else for them. But we work very hard to make sure that whoever is going to be living in your home, we look at everything carefully. So that's why we do that interview, we do a home study, and we make sure that you are part of meeting the individual, feeling comfortable. So there is a process. If you want to do a couple of overnights with someone, that is something that you are able to do. If you prefer to meet them in the community a couple of times, that is also something that you can do. So sometimes we have families. So families, that are part of the individual. So that is something that we also sometimes see, that we see that individuals may have family members involved, and some of them may not have family members involved in the process of the matching. Some of the individuals could be their own guardians, so some of them make their own decision of whether they want to live with you or not. But like I said, this is a matching process, so it has to be a mutual decision between the home provider and the individual when we do this matching. So obviously, family and the individual decide where to meet, like I discussed. So if you guys feel like meeting out in the community, that is an option. If you decide that you want to meet in your home, that is an option as well. We also have the option of meeting in our office. We do help facilitate. So we do help with introductions. So you're not alone. You're not going to just meet this individual and that's it. We are there to support you in that first meeting. Sometimes both parties, agree to meet afterwards. So sometimes they meet for the very first time, and maybe that didn't work out. And if it works out, then they agree to continue to do further meetings. Some of them have, the ability to visit each other's home. So that is an option if you want to visit their home or they want to come to your home. Whatever it works, is that's basically what we want. We want both individuals to feel comfortable. So we want you to feel comfortable. We also want the individual to feel comfortable. So going from the consistency of one family to another. So um, some of you may say, well, why share living? Why this kind of program? A lot of them have been in a group home for several years, and being in a group home, there's a lot of changes. So sometimes there's no staff. Sometimes, they always get the same person. Sometimes there's turnovers. That sometimes they don't even get a choice to do, to decide what they want to do. So living in that in a group home style doesn't give the individual that choice of saying, I want to do this. A lot of our individuals also find that being in this type of environment is loud, and they want a quiet and calm living environment. So they want to live with the family. They want to travel. They want to be part of going out in the community and doing things that they like to do. So this gives them a choice. Being in a group home does not, and they don't get to do the things that they actually want to do. They're on a schedule. So this allows them to have a choice, and that's why this program is great, because it allows them to be able to have a voice. So this picture here is actually from one of our individuals who sadly passed away years ago. But this was one of our individuals that the woman to the left is a shared living provider, and the individual to the right is wrote this actual quote, and he said, "When I go to bed at night, Lisa is there. When I wake up in the morning, Lisa is there." This is a very touching quote, because like I said, earlier, this individual had lived in a group home setting, and he was there for basically all his life, and he ended up finding this wonderful provider that he was very successful in this share living arrangement. He had a choice. This provider would take him on vacation, would involve him in family activities, and was there as a support. And some of our individuals just really want companionship. They want to be they want to be loved. They want somebody to care for them. They want to have a choice. And this was one of our individuals that basically this provider was everything for him. This meant the world for him. He found comfort in this provider, and he found, it was a different lifestyle versus living in a group home where everything was a schedule, and here he had a choice. These are also individuals of other pictures of our share living provider. The lady to the right is a share living provider, and the individual in the middle is an individual in our program, and the individual to the left is a sister. So sometimes family are involved. So this is the good thing. Sometimes you have family that are part of the individual's life. So it's great when you have that support. So you're not alone. You may have families that are involved, and you may have an individual that may not have family that are involved. But in this case, this provider did have the support of the family. So the matching process. So obviously both the home provider and the individual have to select each other. So this is not a placement. This is a matching process. You both have to be in agreement that you both want to live with each other, and it has to be compatible. And here is also a picture of two actually providers with their individuals. So as you can see in this picture. And these are also more pictures. This individual actually, this lady lived in foster care, and she ended up transitioning into shared living, because that's the other thing. Some of our individuals transition from the foster care system into shared living, because in order to also qualify, you have to be 21 and above. So a lot of them come from that foster care. But this individual happened to transition from the foster care into shared living and found this wonderful provider. And look how, you know, they're having a great time here. So what happens once you get matched? There is 24/7 case management support. We do have nursing and psych help. There's respite support, so you can have a break. So respite is basically somebody that temporarily provides relief to you, and you can use it however you want. You can use it for a couple hours here and there, or you can use it, you know, for a whole week, or maybe you have a 2-week vacation. So it's basically left on the provider to use it however they want. There is professional expertise and the ability to connect with the largest shared living network in Rhode Island. So. And there's always great people waiting to join your home and family. These individuals want to get out of whatever situation that they are, and they want to live in this type of lifestyle. Here we do have a couple of pictures with home providers and their individuals. And to be honest, I've actually been with Living Innovations for 10 years, and I have seen a lot of these individuals thrive. I mean, you see the light in their eyes, you see the change. These providers do a wonderful job. They take them everywhere. They're part of a family, you know, and it's a wonderful program. You see the changes in these individuals, and it's a wonderful program. I mean, it is amazing. As you can see here, these are providers that have actually been with their individuals for several years. Do any of you have any questions about the shared living program?
Melissa, so what is the best route to take if folks want to get this process started?
So we do have individuals apply through our Living Innovations website. It's a very simple process. They basically go to livinginnovations.com and they submit where it says home providers opportunities. They click on that, and it's a simple inquiry. It's a simple inquiry where it will ask the person's name, address, and basic information. Another way to apply is also by calling me. I can also help you complete that inquiry, and I can also help you get you started. So my cell number, the company cell, is 401-871-6411. And I work Monday through Friday from 8:30 to 5. So I'll be able to answer if somebody wants to send me a text, or if somebody wants to call. I'd be able to help with any questions regarding this kind of program.
Perfect. Thank you so much for that. I don't see any more questions at the moment. Do you have any last words?
No, I just want to thank everyone for being part of this presentation. If you guys have any questions, so if you guys want to learn more about the Share Living program, or even the other programs that we have, you're more than welcome to visit our Living Innovations website, or like I said, you can give me a call and I'll be happy to answer any questions.
Perfect. Thank you so much, Melissa. We really appreciate you taking the time to present this with us.
Thank you. You guys have a great day. Take care.
You too. Take care.
Bye.
Bye.